Hello everyone, my name is Aamna Rashid and I'm based in Islamabad, the capital city of Pakistan. I'm a public health specialist with an experience of almost 21 years in public health sector. During my work journey, I worked on different public health issues including TB, HIV, mother and child health, but most part of my career has been focused on TB. TB is real. In Pakistan, like many other countries, TB is one of the major public health issues. Around 45,000 people die of TB every year in Pakistan. This is really heartbreaking because TB is not only a preventable disease, but is also curable. And I believe that people are dying just because either they lack knowledge or they don't have access to TB care services. I am honored and privileged to be part of an organization which is working to end TB from Pakistan since 2002. I'm currently associated with Mercy Corps as a senior program manager for their TB program. The program is funded by the Global Fund, and Mercy Corps is an international not-for-profit organization working on TB as a private sector principal recipient. I'm leading this countrywide TB program in Mercy Corps, where we have engaged more than 10,000 private healthcare providers, several large hospitals, laboratories, and pharmacies. And we are trying to bring the services closer to the communities through our outreach chest camps, and also trying to improve the access to the quality diagnosis through specimen transportation model. It has been an incredible experience of saving the lives of people through whatever contribution I was able to make with the support of my team and implementing partners. In our religion, Islam, it is written in our holy book that saving life of one person is like saving the life of the whole humanity. So I really feel privileged and honored that God has given me this opportunity, that through my job, I'm able to serve the most disadvantaged segments of our society. And I would love to do more to contribute towards the elimination of TB, to save lives of many more people. At Mercy Corps, we work very closely with the national and provincial TB control programs. We have engaged private healthcare providers through a mapping process where we select them based on a selection criteria. We sign MOUs with them. We provide them training on standardized TB case management guidelines. And we have also provided them some incentives. And these incentives are basically to facilitate the patients so that providers can provide patients free of cost TB care services. With the cluster of these private healthcare providers, we link one private lab. Again, we select these labs through a mapping process, and these labs are being equipped with microscopes through the Global Fund support. We have also engaged pharmacies to identify missing TB cases and also to trace the private healthcare providers who are treating TB patients, but they are not part of the network. And whenever they identify TB patients, those patients are not captured in the national system. In Pakistan, engaging private providers is extremely important because for more than 80% of the population, the first point of contact is a private provider. We have also initiated a countrywide specimen transportation system to improve the accessibility of quality diagnosis among communities. It is a rider-based model in which community volunteers riders, they get themselves registered through a mobile application. And whenever there is a sample which is to be collected from a private or public health facility or a laboratory, the rider, they gets the message through an online system. They book their ride and then they collect the sample using QR code scanning system, and then they transport those samples to the nearest expert sites. In addition, we have also engaged large private hospitals. In some of these hospitals, we have our TB screeners placed, who are responsible to verbally screen the whole OPD. They identify the presumptives, and then they link those presumptives to the private providers and the laboratories which are within the same hospitals. In some of these hospitals, we also have expert testing facility, and now because we are focusing more on preventive treatment, so we are planning to establish X-ray facility sites in these hospitals as well. Through our outreach test camps, we identify hotspots. We are using mobile vans, which are equipped with digital X-ray machines, and some of them also have expert testing facilities. So basically, through these camps, we are bringing the services closer to the communities and providing both screening and diagnostic services at their doorstep. I'm proud to share that we register around 15 to 20,000 TB patients every quarter. And so saving lives of thousands of people, which is a huge motivation for me and my team to take this work forward. In terms of the investment, I believe that there is a dire need to invest more and more in TB. Firstly, because COVID has badly impacted the progress to combat TB, as we all know. And also, several efforts have been made both by the public and private sector stakeholders, but we still many cases of tuberculosis. And in order to reach these missing TB cases and to treat them and to minimize the spread of the disease, both active and intensified case finding is crucial. I also believe that advocacy and awareness raising is extremely important, not only to create a demand, but also to provide these services to the communities. Now, I'm extremely grateful to Global Fund, who have been funding TB grant in our country as well as in many other countries around the world. It's a big support, especially for the low and middle income countries, where we are able to provide quality diagnostic and treatment services to the communities. And at the end, I would like to encourage all the key stakeholders to join hands for ending TB from this world, as TB is not just a public health issue, but a disease which requires multi-sectoral collaboration. And I think if we need to end TB, it's very important that we design and implement patient-centered approaches so that we can align our TB care services with patients' needs and preferences. There is also a dire need of government stewardship, improved treatment coverage through engagement of both public and private healthcare providers, and engagement of civil society organizations and communities in order to end TB. Thank you.